And she started screaming because I'd slept on the hardwood floor with her the night before because she was so miserable. And the alarm clocks went off and she started yelling, "Mommy, Mommy, I can't open my eyes." So I called the doctor and he goes, "You got two choices. You can meet me at the hospital or you can come in at 9 o'clock in the office." And it was like 6 o'clock in the morning. I said, 5 minutes, we will be up at the hospital. And we went up to the hospital and within 45 minutes, she had 5 doctors in there with her.
And we were just young kids, so we really didn't know a whole lot. And there was really not a lot of information on Stevens-Johnson syndrome. So everything was basically new and scary. And a lot of the doctors at the beginning was like, "Oh, she'll be past this in a month's time, she'll get past it." Well, that was a rude awakening 30-some years later. You don't get past it, it's just a new adventure. Every week, you learn something new and another difficulty.
I remember vividly, she needed to use the bathroom and I picked her up and put her on the commode, and where I had touched her on both sides of her little body, my hands had sloughed the skin entirely off. And it was just that little contact, just opened that first layer of skin, and it was open like a brand new burn. One of the other things, after I got her back to bed, I noticed I didn't have a rhythm on the monitor, and we keep all our patients in the ICU on monitors. So I went back in and lifted up her gown and looked, and each electrode that had been stuck to her chest was hanging by a piece of skin that had completely pulled away from her body. And so you think of it like a really, really bad sunburn where you get the blisters and the fluid and the skin just sloughs off, and then what's underneath is all wet and open, and it's painful. So here's this little girl, 6 years old, who has no skin protection, and everything is open and raw.
If she has a headache, I freak out. It's just everything. I mean, there's days that I just go in and cry.
Yeah.
I just don't know what to do. It's like, what did I do? Why us? I mean, there's not a day that goes by that I'm not thankful. We have her with us because I know that we could have very well lost her.
As a kid, I really didn't understand. I knew I had medical problems, but to really understand it, I didn't until about high school, when I had to take a PE class for the credit in order to graduate. Well, I couldn't be in a regular PE, so thankfully they put me in a weight training class, and the teacher adapted it to my level. That way I felt included and was able to get the credits. And the teacher accepted it, and she had me show my SJS photo album to the class, and then that's what opened the door, and I started getting comfortable talking about SJS and what I had and the number of surgeries, because even my classmates knew I missed a lot of school, but they really didn't know. And then it continued, and when I first got the internet, I was curious, what is SJS? So I started looking it up and I learned more. And then I was able to accept it. And then a few years later, I got more comfortable. And that's when I started talking about it more and started a foundation.
My name is Heidi Madel. My son is Ethan. He is 20 years old, and he was diagnosed with Stevens-Johnson syndrome in March of 2009. He had come home from school the day that school let out for spring break, and he hadn't been feeling well that morning. I'd given him some Tylenol to get him through the day and just get into spring break. And he came home and was not feeling well. He had been playing with a friend in the basement. They were building Legos, and I went downstairs and Ethan was just laying on the ground. It's not that he was unconscious, but he just was completely overwhelmed by feeling so sick. We sent his friend home and just let him rest. Had a fever, and then the next day I noticed he started developing little red pinprick sized dots on his cheeks, and then his eyes started kind of filling in on the sclera, which is the white part. They started kind of turning blood red. The fever got higher. We had taken him that next day to our local emergency room, who checked him out and thought that he was coming down or developing Kawasaki syndrome, and had sent us home. And hours later, he had developed just an inner itch in his whole body that he could barely control. It was driving him beyond crazy, and for a little boy to be experiencing that was really unusual. We went back to the emergency room and we asked, to be seen again, that he just wasn't getting better. Nothing was happening. We were supposed to see his pediatrician on Monday regarding his Kawasaki syndrome. And we just said, we're coming back. We don't think he's okay. And they rehydrated him, discharged him again. And as we were walking out the door, a doctor that had been actually trained at Loyola University in Chicago happened to be working out here in Indiana and said, "Hey, are you guys going home?" And we said yes. And Ethan was still not feeling well, and he said, "Let me see you guys for a second." There had been another doctor that had discharged us for the second time. And he looked at Ethan for about a minute and said, "Oh, buddy, you're not going home." He ended up calling an ambulance from Chicago, and we transferred him immediately. But for almost 3 days, they thought that it was an infectious disease. So they just were pounding him with medication every 2 hours because it was slowly killing him. It took until he started developing symptoms. That was Thursday at school. He was not properly diagnosed and transferred to Loyola unit, the burn unit, until the following Wednesday or Thursday. So many days and many doses of medication later. He was almost unconscious by the time we were transferred to Loyola, and we were transferred in an ambulance with a respiratory therapist because his airway was closing. They intubated Ethan within minutes of arriving at Loyola, and put into a medically induced coma for about 5.5 weeks, and a few eye surgeries. They placed amniotic membrane in his eyelids and over his eyes. And they, of course, ultimately saved his life at the burn unit there at Loyola University. And it's been a really long road for us since. He's had over 100, probably 115 eye surgeries. He's got one good eye that he's able to use, but he has a lot of complications in that eye as of the last few years. He's developed glaucoma. He has retina issues now. He has a lot going on and is what we call his good eye. And so it's a real strain for him every day, every moment. And it's really, really stressful on us as his mom and dad and the whole family.
Hi, I'm Dr. Elizabeth Phillips. I'm a professor of medicine and pharmacology, and I'm at Vanderbilt University Medical Center. And for the last, 25 to 30 years, I have focused on the treatment and research of severe immune-mediated drug reactions and trying, to solve the puzzle on why some people are affected by this, and trying really to understand the science behind them and how we can actually prevent these in the future. And of course, Stevens-Johnson syndrome and toxic epidermal necrolysis is one of the deadliest of these types of reactions. So it has particular attraction in terms of the individuals and the families that it affects. You know, the puzzles and the questions, you know, have not, you know, there's some things that have been solved, and, you know, it's very gratifying to know that we can actually prevent some of these terrible reactions through genetic testing now and through risk stratification, but the puzzles just keep getting deeper and deeper, and the questions are less probing than they were 25 years ago. And so it's a very, what I would say, young field with a lot of questions that are really important.
For me personally, I've always said, how can I feel so unlucky yet lucky in the same breath? Because you almost lose a child, they survive, and then you kind of wake up to a world where everything is more beautiful. Every giggle you hear, every smile is 10 times more beautiful than you may not have realized before. So I really appreciate life and my children in a totally different way, different viewpoint that I didn't have before going through a tragedy of this magnitude.
At first, you did kind of harp on that, like, why me? But I think it's better doing a car show, doing something exciting, doing something fun. And I think it gets our mind past it, and it keeps our mind thinking in other directions, because you're not gonna get any education being in a corner, poor little old me. I think it's better to get out there and let the people know, and I think that's the biggest thrill for me, is to let the people know and not hide it.
This year, we were able to donate $5,000 to Vanderbilt SJS Research Fund. We were also able to donate coloring books and games to our local hospital. We're also able to make our SJS info packets to be able to drop off to the doctors and nurses, and then any other awareness projects we want to do to get our name out in the community, because we want people to look up, what is SJS? So if this happens to a loved one, you're able to quickly diagnose it, and that includes doctors and nurses.